Hello and welcome everybody to the COVID-19 and Gender and Wash and Cash Transfers webinar. Welcome to our webinar. We're really pleased that you can join us, and we're really looking forward to a fantastic webinar with a team of people. I just want to go over a few housekeeping things before we start. I can see that everybody has their microphones on mute, which is great. And if you have any questions or comments, please feel free to use the chat box function in Zoom. If you've got questions throughout the webinar, we have people who are going to collect and collate those questions, and we will have a combined question and answer session towards the end of the webinar. Today we have 4 presenters for the webinar. We're going to have a single question and answer session at the end of the webinar, so please feel free to write your questions in the chat box and we can answer those at the end of the webinar. We have 4 presenters for our webinar today. The first presenter is Josue Orellana Guevara. Josue was born in Bolivia. He's a physician, and he also holds a Master of Public Health from the Loma Linda University. He has developed a special interest in community health and international health. Dr. Orellana joined the Adventist Development Relief Agency in 2002 and has held various positions within the Global ADRA network, acquiring extensive experience in international health and development. Most recently, he has spent 4 years as ADRA Country Office Director in Mongolia, 3 years as the Country Director in Nepal, and in 2018, he took the role of the Director for Health, Nutrition and Wash for ADRA International. As part of his professional career, Dr. Orellana has been involved in emergency response in the health sector as well as other sectors, working on the front line and at managerial level in several countries. He's also been engaged in interventions to promote healthy behaviours and best practices in maternal and child health, reproductive health, nutrition and hygiene, and non-communicable diseases, including tobacco control and lifestyle programming. Our second speaker is Helena Souders. Helena works currently as a program manager for ADRA International, and she has also worked as a volunteer in the past for ADRA France and Internet for ADRA Thailand, and she's also been at ADRA International for 6.5 years. Our third speaker is Maria Innocente. Maria has a degree in political science from the National University of Rosario, Argentina, and a master's degree in political sociology from the Latin American Faculty of Social Sciences, Ecuador. She's a specialist in migration and asylum with a human rights perspective from the National University of Lanús in Argentina. Currently, she is a protection and gender officer for ADRA Ecuador with an experience in gender specialist positions in various organizations. Our fourth and final speaker for today is Chris Winger, who has worked in international development for 20 years, both in the field as a country director, chief of party, deputy project manager, and also in the Home Office, program management and business development with ADRA International for 4 different organizations. He has lived and worked in Latin America, Africa, and Asia across a broad array of public health projects. Today we have, first up, we're going to be listening to Josue, who is going to be talking about the current COVID-19 situation. And after Josue, Helena is going to be speaking about gender and cash transfers, followed by Valeria, who will be talking about gender and wash, and Chris will be speaking about food distribution. So thank you very much to our 4 speakers. I'd like to give you in particular a warm welcome. And first and foremost, Josue, I welcome you as our first speaker. Thanks, Josue.
Thank you, Victoria, and welcome everyone again. Good morning, good afternoon, or good evening. Let me make a very brief introduction to COVID-19, which is probably not new to all of us. We're all listening about it in the news every day and reading about it, maybe dealing with it in our daily work. So we all know more or less what it is about, but I'll just make a brief introduction in order to put us into context before this webinar goes into the main topic for it. Some health-related considerations. As we probably know very well by now, COVID-19 goes in waves, and it goes in waves in different places and different seasons. It seems that the weather does have some impact, because in those countries that are located in the northern hemisphere, there is a resurgence of cases, and that can be also caused by what we call COVID fatigue. And people are tired of the preventive measures that we have to follow. So anyway, the situation is still going on. Southern hemisphere seems to be doing a little bit better in some cases, but it's too early to say. It's improving. So far, as you have probably seen, according to the Johns Hopkins tracking website, there are more than 55 million cases that have been recorded worldwide. That doesn't mean that those 55 million cases are active right now. It means those are the cases that have been recorded so far globally. We are all learning about it, and in some cases, recommendations are changing as science is bringing more advice, more evidence, and in some cases, unfortunately, decisions are not always made based on science. But from country to country, things are changing as well, the way how governments are dealing with it. Underlying risks are still there even after a vaccine is available. As you probably know, 2 of the vaccine developers have announced the past 2-3 days that their vaccines have shown a high level of efficacy to protect an individual who has been vaccinated, over 90% of protection. And we also know that Russia has already submitted their vaccine for approval to the WHO. We don't know how long it will take for them to go through the process and do the necessary approval. But even if a vaccine were available today, it doesn't mean that most of the population will be vaccinated right now, because it's just logistically not possible. So it will be a process of several months, in some cases of some countries, several years, to get a reasonable amount of the population vaccinated to acquire herd immunity. So that is going to take some time. That means that we still need to continue to pay attention to the preventive measures and the protections that we already know, washing our hands and keeping physical distance and using our mask and all those things that we know very well. But now I would like to make a few considerations that are more related to gender in general. Can we go to the next slide? Okay. So we still lack availability of data disaggregated by sex and age. There is some data available, but in many cases and in many countries, that data is still not available. So it's difficult to tell how this pandemic is affecting some groups of our population. Violence against women and children increases during lockdowns. Unfortunately, the most vulnerable suffer more during those lockdowns that are needed in some cases, but it has its side effects. Access to sexual and reproductive health and rights for women and girls may be reduced during the pandemic. A clear example of this is access to family planning services, that in many countries has been considered as a non-essential service, and therefore it has been suspended for several months with the implications that it brings to the clients that were needing access to it. Health and social workers face increased risk and vulnerability. We have to keep in mind that women make up around 70% of the global healthcare workforce. So that's counting all the professions, and nurses, doctors, lab technicians, social workers, psychologists, and others. So are they being properly protected? Is there enough personal protective equipment to protect them from getting infected with the virus? And then the other consequences into their personal and family life, right? Because many of them, besides working in a health facility, they are also mothers, and they are also part of a family. So in many cases, they have to struggle with keeping their job and looking after their children sometimes. And sometimes their kids are not in school anymore. So it creates a lot of complications. That's the other thing that has to be considered when it comes to COVID-19 and gender implications. Let's go to the next slide. So we have inequities of access to information, prevention, care, and financial and social protection, which are likely to affect people disproportionately. Unfortunately, we have seen several examples of that. When it comes to income, when it comes to even having access to information in a way that people can understand it. We have not always made sure that, and when I say we, I'm referring to the global efforts that have been made. We have not always made sure that information is being shared in a way that everyone can understand it, so they can practice those prevention measures. And finally, increased stigma and discrimination are occurring and can hamper effective response. The cutting line is not very clear between what is needed and going beyond that. For example, lockdowns, quarantines, those kind of things are needed at some point in time to control the spread of the virus, and especially to make sure that there are enough healthcare facilities to provide healthcare for those who are seriously ill with COVID-19. But lockdowns are not harmless. They have their side effects as well. So keeping a good balance between those two things is not always easy. And that affects disproportionately sometimes parts of the population. I will stop here as a brief introduction to the topic for today, and I can answer questions at the end of the session. Thank you.
Good morning, everyone. As Victoria said, my name is Elena Souders, and I am a program manager at ADRA International. I currently manage Brazil, USAID portfolios in Brazil, Colombia, and Honduras. So I'm realizing now that when we were preparing for today, I very much focused just on cash interventions that have to do with food security. And at the time, I only had the program in Brazil. So you'll see the presentation is focused on Brazil in particular. However, if it's all right with the organizers, I will take just a minute or two at the end to mention adaptations of cash transfer in both Colombia and Honduras, if that's all right, even though they have, Colombia in particular is not a food program, and Honduras is just getting started as a food program. So if that's all right, you can just let me know through the chat or here right now. It's up to you. So let's get started. Our programming in Brazil actually began in 2018. Not too long after Venezuelans started leaving their homeland, their home country at very large scale numbers. In Brazil in particular, you could have about 800 people coming in at any time every day when the borders are open. So it's a significant amount of people coming through the border in Brazil. So this project in particular that I'm going to present on is the second iteration of our food security program in this particular area. The donor for this project is Food for Peace, USAID's Office for Food for Peace. And our goal was to provide a food security intervention for Venezuelan migrants in Brazil. We made it very broad. Usually goals should be very specific as to where, but we made it broad for the whole of Brazil because we were also doing complementarity work between our OFDA funded project that was moving Venezuelan migrants from a particular part of Brazil to different areas in Brazil where we were able to connect them with jobs. So to give us that flexibility, we kept it broad in that way. Our number of beneficiaries is, or was, our goal was 21,445 total. Specifically 1,706 in Roraima, and 2,400 in Brazil, and then various other numbers spread through the same state of Roraima to equal the 21,000. Thank you, Carrie. So our modality were two different kinds. We had the electronic voucher, which was provided by a company called Sodexo, and we also had hot meals, which I did not focus on here since it's not a cash transfer program. So the gender dynamics at the beginning of the program were that we were noticing that the Venezuelan migrants themselves or their households were choosing the male figurehead as the head of household. However, we did get reports from different beneficiaries that this was causing conflict within the home. And there were some instances, sorry, Carrie, we can go into the next slide. There were some instances in which beneficiaries actually reported that in some of the households, some of the male heads of households decided to leave the family and they would take the e-voucher with them. So as an immediate response, ADRA contacted the company providing the service for us, and we were able to cancel those electronic vouchers and provide new ones now registered to the woman in the household. So what we started doing throughout, and this was even right before COVID-19 hit, is that we invited anybody who identified as part of the head of household to the registration process. So we invited, if we identified that there were a male and a female in the home, we invited both to the registration process and made a very big emphasis on the need for both to be involved in the nutrition sensitization awareness sessions, as well as being involved in understanding how the benefit works, what ADRA had to offer, and who the donor is from. Additionally, we would ask them to please choose the person most appropriate that would be responsible for purchasing the food and preparing the food to please be the head of household. And what happened here is that there was a big natural shift now where the households themselves were the ones telling us, oh, please give the voucher to the woman in the household. And this mitigated a lot of the issues we were having. During COVID-19, the way that we continued reinforcing this was through constant contact, or is through constant contact via WhatsApp, telephone calls, and at times video calls. They will do video chats with a large group of beneficiaries. And again, we continue encouraging and establishing the importance of having both a male and female involved in the household decisions and specifically in understanding what our e-voucher food benefit is for their families. And that so far seems to be working well. We haven't had really any more reports of instances in which conflict has been caused by the electronic voucher, or even, mails leaving with the electronic voucher. We also haven't had to do too much of an adaptation as far as the distribution goes, because since it's electronic, it's automated already. So we had accomplished all the physical distributions of let's call it a credit card, if you will, to the beneficiaries in the latter months of 2019. So when the COVID-19 crisis began, we no longer had to gather large groups of people for that initial distribution, because everything is done electronically by Sodexo. So ADRA has a list of people and who should be receiving what amount each month. We convey that to Sodexo, and they automatically provide the renewals. So that's worked very well. As far as Colombia goes, we have a physical voucher distribution there. It's not electronic, for non-food items in the wash sector, specifically hygiene items, for the same segment of population, Venezuelan migrants. We did have to do large adaptations for this. In Colombia, we used to gather large numbers of our beneficiaries into one space to provide the wash sensitization messaging specifically on hand washing. And then right after they went through that session is when they would receive their voucher. However, we could no longer gather 80 to 100 people in one space given the situation. So what ADRA did was actually work very closely with the providers that are accepting our voucher. And we provided a list each day of people that would be able to go to the shop, pick up their voucher, and go ahead and carry out their purchases. The list also had a specific code that matched the beneficiary name. And what ADRA did was call the beneficiary, give them their unique code that they would have to provide to the shop, to the provider, as well as their ADRA ID card. So with their ADRA ID card and their unique beneficiary code, they were able to pick up their voucher and go ahead and purchase their hygiene items. So that's been the adaptation in Colombia as far as cash transfers go. And finally, in Honduras, just in the past 4 weeks, we've began a food security project in which originally we wanted to do cash transfers to beneficiaries. However, because of the COVID-19 situation and the way that the country has handled it with the lockdowns and how rural the areas are that we're working in, we've switched to an in-kind modality. So we are working with different supermarkets in the areas that we're working with that will prepare the food baskets for each household, and they will be delivered a few people at a time so that they're not gathered in one place and potentially, having a super spreader event. So that's been the way that we've adapted in Honduras. We do have built in with our adapted proposal flexibility to go back to the cash transfer modality if the situation allows for that eventually with COVID-19. But as for right now, it continues to be in-kind baskets being provided to the beneficiaries. And that is all I have for you. Thank you very much. I see that there are some questions in the chat, so I'll wait until the end of everyone's presentation to address them. Thank you.
Thanks, Helena. Very much appreciate your presentation. And I just want to welcome Valeria to the next session. Valeria is going to be presenting in Spanish, and we're grateful to have Deborah to translate what she is going to say. So thank you and welcome, Valeria.
Buenos días a todos y todas. Como ya escucharon, mi presentación va a ser en español y le damos muchas gracias a Debra, que va a hacer la interpretación de esta presentación. Igualmente, para aquellos que de pronto quieran escucharla en español, entiendo que pueden poner en interpretación español. ¿Debra? Bien. Entonces, vamos a continuar. Yo voy a hablar de cómo transversalizar el enfoque de género en las intervenciones de agua, saneamiento e higiene en el contexto de COVID-19. Voy a hablar lento, entonces podemos ir siguiendo la interpretación o la traducción. Primero voy a hacer una presentación rápida de los estándares a nivel internacional acerca de el enfoque de género en las intervenciones de agua, saneamiento e higiene, y luego voy a hablar de las buenas prácticas que tenemos en algunas intervenciones de agua, saneamiento e higiene en Ecuador o en ADRA Ecuador. Bien, primero es importante saber por qué transversalizar el género en las intervenciones de WASH. Sabemos que cuando hablamos de género o de enfoque de género, lo que queremos hacer es mirar o reconocer las desigualdades estructurales que existen en nuestras sociedades entre hombres y mujeres, ¿sí? Debido a las diferenciaciones entre roles, asignaciones de responsabilidades, oportunidades. Entonces lo que queremos hacer es ponernos las gafas, o más bien quitarnos las vendas, para poder mirar la realidad de esta manera y desde todas las intervenciones que realizamos poder, digamos, prevenir situaciones, pero también actuar de manera proactiva, intentando generar equidad de género, ¿sí? Sabemos entonces que estas estructuras de desigualdad de género permean a todas nuestras sociedades. Y todos los fenómenos sociales, políticos y económicos impactan de manera diferenciada a hombres y a mujeres, a niños y a niñas. Esto no es una cosa diferente en las emergencias y sobre todo en las emergencias sanitarias. Aquí tomé una pequeña cita de la Mesa de Género de la Red LAC, que es una organización interagencial regional de América Latina y el Caribe, que nos dice justamente, las emergencias sanitarias afectan de manera distinta o diferenciada a mujeres, hombres, niñas, niños, adolescentes y personas LGTBIQ+, ¿sí? Y reconocerlo es clave para poder asegurar una respuesta humanitaria más eficaz y pertinente, centrada en las personas y sensible al género. ¿Y qué hay de los...
Valeria, sorry, can I just interrupt you? For those of you who want to hear the presentation in English, you will need to go down to the bottom of your Zoom screen and click on the English option so that you can hear Deborah translating this into English. This will move you into another room so that you can actually hear the English translation. Sorry for not explaining that earlier. Thanks, Valeria. Sorry to interrupt you.
No hay problema, muchas gracias. Bien, entonces decía, ¿y qué hay de las intervenciones de agua, saneamiento e higiene? ¿Por qué incorporar el enfoque de género allí? Desde aquí, digamos, podemos mirar en dos dimensiones específicamente el enfoque de género. Por un lado, mirar la dimensión de las diferencias que existen entre las necesidades y las prioridades para hombres y niños y para mujeres y niñas, ¿sí? Que, como decíamos antes, como existen diferentes actividades y responsabilidades atribuidas a cada género, entonces estas necesidades y prioridades también son diferentes. Y la otra dimensión es mirar las desigualdades en el control de los recursos hídricos y en el acceso a ellos y a los servicios de saneamiento, ¿ya? Esto es un poco una propuesta de cómo mirar las dimensiones dentro del enfoque de género en intervenciones de WASH desde UNICEF. Aquí es importante decir una cosa más, y es que cuando nosotros transversalizamos el enfoque de género en las intervenciones de WASH, también estamos mejorando los resultados mismos en relación a el agua, saneamiento e higiene. Entonces, algunos ejemplos de esto son, por ejemplo, mejoramos la gestión y el funcionamiento eficaz del abastecimiento del agua, la reducción, por ejemplo, de lo que se llama la defecación al aire libre, ¿sí? Al transversalizar el enfoque de género, lo que hacemos es mirar que las instalaciones por ejemplo, sanitarias, deben estar diferenciadas, diferenciadas por sexo, tener unos lugares específicos, y esto hace entonces que se evite cada vez más lo que se llama defecación al aire libre. Entre otras mejoras, o sea, lo que quiero decir es que transversalizar el enfoque de género no solo va a mejorar resultados en términos de equidad de género, sino también en términos de agua, saneamiento e higiene. Ahora sí, la siguiente. La siguiente diapositiva, gracias. Bien, aquí rápidamente comentarles, existe de esta mesa de género de la Red LAC una guía con claves de género para la respuesta ante la emergencia sanitaria, en donde nos da algunas claves en cada uno de los sectores para poder transversalizar el enfoque. En términos generales, nos dan cuatro acciones claves para todos los sectores, para toda la respuesta humanitaria, que me gustaría, digamos, compartirlas porque nos permiten, digamos, empezar a pensar no solo en las intervenciones de agua, saneamiento e higiene, sino en todas las acciones, en todos los sectores. Entonces, la primera es siempre identificar necesidades, tanto en la etapa de preparación como de respuesta en todo tipo de emergencias. Identificar necesidades, nos referimos a identificar necesidades específicas de mujeres, niñas, niños y personas LGTBI. Para esto, digamos, al identificar estas necesidades, lo que podemos hacer es adaptar nuestros programas y generar tanto acciones de prevención como acciones de promoción de la equidad de género, ¿verdad? Una segunda acción clave son tener siempre datos por sexo, género y edad. Esto nos va a permitir mirar las brechas que pueden existir durante el proceso de intervención y poder mejorarlas en ese momento. Y también nos va a permitir generar, por ejemplo, informes de incidencia para autoridades, nos va a permitir mejorar nuestros propios programas y políticas en términos de género. La tercera acción clave que nos propone la Red LAC es estar alerta siempre a los riesgos de violencia basada en género, y aquí yo le sumaría tener estrategias específicas de identificación y de referencia, ¿sí? Para casos de violencia basada en género. En todas las intervenciones, esto no tiene que ver solo para programas de protección, ¿no? Tiene que ver en todos los sectores, porque el género tenemos que mirarlo de manera transversal. En el cuarto punto, nos proponen siempre asegurar, y esto es súper clave, la participación de mujeres y niñas. La siguiente diapositiva. Pero entrando un poco más, siguiente diapositiva, gracias. Pero entrando un poquito más en el tema que nos convoca en esta presentación, a agua, saneamiento e higiene, es importante contextualizar un poquito y decir, todas las intervenciones de agua, saneamiento e higiene en emergencias, lo que buscan es prevenir que las personas afectadas por crisis sean propensas a enfermedades, debido a que las mismas crisis les generan mayor probabilidad de padecer enfermedades y de fallecer a consecuencia de ellas. Imagínense en este contexto específico de emergencia sanitaria, ustedes saben que uno de los sectores más fuertes y más importantes en la respuesta a la emergencia sanitaria es justamente el sector de agua, saneamiento e higiene, ¿no? Bien, y para contextualizar un poquito algunas de las actividades que ustedes saben se realizan dentro de este sector son la promoción de las buenas prácticas de la higiene, que eso es algo que se está realizando en todos los países. el suministro de agua potable segura, establecer instalaciones de saneamiento apropiadas, reducir los riesgos ambientales, garantizar condiciones que permitan a las personas vivir con buena salud, dignidad, confort y seguridad. Siguiente diapositiva, por favor. Bien. Según la guía de intervenciones de agua, saneamiento y higiene sensibles al género publicada por UNICEF en 2017, es importante que nosotros transversalicemos el género en todas las etapas de nuestros programas, desde la planificación estratégica hasta la implementación y monitoreo y evaluación. En términos de planificación estratégica es importante tener en cuenta dos momentos para la transversalización del género. Primero, el análisis de situación que siempre realizamos, realizarlo con enfoque de género. Entonces ahí mirar, como decíamos, las necesidades específicas de mujeres, niñas, mirar políticas y programas destinadas a temas de género, y también poder revisar algunos documentos, evaluaciones de otros programas de agua, saneamiento y higiene con enfoque de género. Y con respecto al diseño de proyectos, tenemos ya todas unas normativas estándares que ya deben conocer de cómo diseñar la infraestructura, como por ejemplo, puntos de agua no deben estar a más de 500 metros por el riesgo que genera esta distancia. Las bombas de mano y los contenedores de agua deben ser amigables para mujeres y para niñas, ¿sí? Las instalaciones de agua saneamiento, es decir, baños, duchas, no deben estar a más de 50 metros de los lugares en donde viven, y deben tener una iluminación adecuada, cerraduras internas, vallas, y estar separadas por género, ¿verdad? Bien, la siguiente, por favor. No voy a ahondar muchísimo, solo quiero dar algunos tips rápido para poder pasar a la parte que quería como ahondar más, que son las buenas prácticas, ¿no? En este caso, las experiencias que nosotros tenemos para compartir. Entonces le decía, en la segunda etapa, que es la implementación, también es importante mirar algunas acciones clave como estas que están presentadas aquí para transversalizar el enfoque. Uno es antes de la implementación, cuando ya estamos pensando en la planificación de esa implementación, identificar actividades específicas para alcanzar resultados en materia de género. Adaptar las instalaciones de WASH a necesidades de las mujeres y niñas, considerar, esta me parece importante, las habilidades laborales de mujeres y niñas. A veces en las intervenciones de agua, saneamiento y higiene solo pensamos en que los hombres nos pueden ayudar, de la comunidad, o que nuestro mismo equipo tiene que estar conformado por hombres, porque quizás tienen más capacidades en términos de infraestructura y demás, y no estamos mirando, digamos, ni estamos dando lugar a veces a las mujeres en estas intervenciones. Y en el monitoreo y evaluación, entonces, estar mirando que estas actividades que habíamos planificado en la implementación se estén llevando a cabo, que tengamos un sistema de monitoreo que pueda medir avances en la equidad de género y el empoderamiento, que tengamos también compromiso de otras instituciones locales y organizaciones en materia de género para realizar las actividades de monitoreo, y aquí les vamos a dar luego un ejemplo más adelante. Y como siempre hablamos, la participación de las mujeres y las niñas en todas las etapas de los programas. Pasamos a la siguiente, por favor. Aquí quisiera, traigo a colación esta guía de la mesa de género de la Red LAC, que fue pensada específicamente en el contexto COVID. Y estos son los consejos o las acciones clave para transversalizar el género en las intervenciones de WASH en este contexto de COVID. No voy a contarles de todas, sino simplemente algunas, porque básicamente varias ya las fui comentando antes. De las que dije antes voy a sumar la 3, por ejemplo, en donde es importante siempre, y en este contexto de emergencia sanitaria más, asegurarse de que las mujeres, niñas, adolescentes, personas LGTBIQ+, accedan a información sobre la emergencia sanitaria con enfoque intercultural. ¿Qué es el virus? ¿Cómo se transmite? ¿Cuáles son los probables síntomas? Y cómo se protegen a sí mismas, ¿sí? Esta es una parte importante también que debemos realizar en todas las intervenciones, específicamente en WASH. Las medidas de higiene, por ejemplo, deben incorporar Si quieres, pasa todas para que se complete toda la diapositiva. Ahí está, hasta las 5. Las medidas de higiene deben incorporar las necesidades y condiciones particulares de mujeres y niñas, de acuerdo a su edad y su diversidad. Y un poco también hay que tener en cuenta en la distribución de los insumos de agua, saneamiento e higiene, que pueda ser con enfoque de género, es decir, pensarnos también, por ejemplo, en las necesidades de la higiene menstrual, y también que pueda ser a través de una movilización comunitaria, en donde también participen las mujeres y niñas en el proceso de distribución. Ahora sí pasemos a la siguiente, que es las buenas prácticas que tenemos en las intervenciones de ADRA Ecuador. Siguiente, por favor. Bien, gracias. Entonces, aquí en Ecuador, en el contexto de emergencia sanitaria, hemos tenido hasta el momento dos grandes programas en términos de agua, saneamiento e higiene. ¿Qué buenas prácticas nosotros consideramos para transversalizar el enfoque de género? Primero y siempre súper importante, capacitación de los equipos técnicos. No solo de los equipos técnicos, sino también de los proveedores. Por ejemplo, tenemos algunos proveedores que son tanqueros, es decir, que hacen distribución del agua cuando no hay una red de agua potable, necesitan hacer la distribución por tanqueros, entonces estos proveedores también deben capacitarse, voluntarios y voluntarias, en temas de género, violencia basada en género, protección contra la explotación y abuso sexual, masculinidades y primeros auxilios psicológicos. Y aquí hago un comentario rápido. Parece una locura, digamos, tener que capacitar en todos estos temas a un equipo que quizás en un proyecto va a estar por 6 meses, y también además involucrarles a los proveedores, sobre todo que es muy difícil a veces involucrarles a ellos en estos espacios. Sin embargo, esto es muy importante porque, como ustedes saben, para evitar cualquier situación, digamos, de daño que nosotros podamos causar, necesitamos que nuestro personal esté capacitado. Y además, para que nuestra intervención pueda promover la equidad de género, para que podamos evitar todo tipo de lenguaje sexista, evitar intervenciones que refuercen las diferencias, las desigualdades entre hombres y mujeres, necesitamos tener esa perspectiva. Entonces, algo que le apostamos aquí es a la capacitación previa y durante los equipos. Además, otra cosa importante que ya decía antes, son los procesos de identificación de riesgos e implementación de medidas de prevención. Entonces, cuando comenzamos un programa decimos, a ver, estas son las actividades que tenemos. Por ejemplo, voy a hacer distribución de kits de bioseguridad o kits sanitarios. Voy a hacer instalación de estaciones de lavado de manos. Voy a hacer promoción de la higiene. Ok, ¿qué riesgos puedo tener de protección o de situaciones de violencia de género en esas actividades específicas? ¿Y qué acciones voy a hacer para mitigar o prevenir esos riesgos? También, por ejemplo, una de las buenas prácticas es la implementación de mecanismos de identificación y referencia de casos. Entonces, como les decía, los equipos primero son capacitados en temas de género y violencia de género, y segundo, tienen unos mecanismos específicos determinados en donde, por ejemplo, yo siempre les digo, ¿qué pasa si ustedes están haciendo una distribución de una entrega de kits sanitarios o kits de bioseguridad y se encuentran con una mujer con alertas de violencia de género, o una mujer que les dice, por favor ayúdeme, estoy en esta situación en mi casa? ¿Cómo nosotros reaccionamos, como trabajadores humanitarios damos respuesta? Entonces es por eso que los trabajadores ya están capacitados para atender, identificar y referir inmediatamente este tipo de casos. Otra cosa que hacemos siempre hincapié, y sobre todo en estos programas que tenemos ahora de agua, saneamiento y higiene, es el lenguaje inclusivo. Y aquí nuestra proactividad en generar, digamos, la equidad de género, la conciencia. Entonces, por ejemplo, en esa foto que ven ahí, nuestro logo para uno de los programas que tenemos con USAID es Todos y Todas nos cuidamos. Lo que estamos haciendo es una campaña para concientizar a las personas de las medidas de bioseguridad, y para eso pensamos siempre desde un lenguaje inclusivo, nos comunicamos de esa manera. Luego tenemos también, bueno, criterios de priorización que siempre tienen en cuenta el género. Un punto muy importante y que a mí me parece que suma es realizar monitoreos específicos de género y de protección en territorio. Entonces, por ejemplo, ¿qué hacemos? Tenemos en ADRA Ecuador un departamento de género y protección, y lo que hace este departamento es visitas, o sea, contamos con especialistas en protección y género que hacen visitas en territorio a las intervenciones de WASH y que miran en territorio cómo están siendo esas actividades, cómo podemos mejorar, qué riesgos hay. Siempre la mirada especializada en estos temas es importante, y no porque sean intervenciones en agua, saneamiento y higiene no requieren especialistas en género, ¿ok? Luego, siempre importante la participación de las mujeres, por ejemplo, en las comisiones de trabajo. Aquí una experiencia interesante que tenemos es en la infraestructura de agua, saneamiento y higiene que tenemos en nuestros albergues. Aquí los desafíos son siempre que en cada albergue hay que pensar bien la ubicación, la iluminación de los espacios sanitarios, de los baños y las duchas, ¿sí? Por ejemplo, teníamos en uno de los centros de alojamiento unos espacios de baños para hombres, mujeres, niños y niñas que estaban todos juntos, sin una división, digamos. O sea, tenían cada uno su cartel, pero no están divididos en el espacio de comedor. Y aquí entonces, como no podemos modificar eso estructuralmente, lo que hacemos es pensar una metodología para el uso de esas baterías de agua, saneamiento y higiene para evitar situaciones de riesgo, por ejemplo, para niños y niñas. Entonces, ¿qué hicimos? Dijimos, ok, los baños de hombres y de mujeres adultas se van a cerrar, van a estar cerrados siempre, solo se van a utilizar los de niños y niñas porque están cerca del espacio amigable en ese momento, y los de hombres y mujeres solo se van a utilizar cuando se requiera, por ejemplo, haya algún taller, algún evento, y en ese momento se cierren los de niños y niñas. Entonces también no solo pensarnos desde la infraestructura, sino también desde las metodologías, ¿sí? Y finalmente la promoción de la higiene menstrual que hemos hecho en otros programas de agua, saneamiento e higiene, siempre pensarnos desde la libertad de tabúes, y siempre nosotros, digamos, intentar o evitar lenguaje sexista, evitar frases como, ah, claro, sí, es que las mujeres una vez al mes nadie las entiende, ¿sí? Todo esto, entonces, cuando nosotros hacemos esa promoción de la higiene menstrual, también intentamos ir sacando esos tabúes. Bien, eso era lo que les quería compartir. Pasamos a la última. Aquí rápidamente solo mostrarles los recursos de consulta que tienen para transversalizar el género en las intervenciones de agua, saneamiento e higiene. Existen estos que son los básicos y muchos más. Si luego alguno quisiera acceder, digamos, podemos hacerlo, yo les puedo enviar. Y bien, esto es todo. Muchas gracias.
Good morning, all. My name is Chris Winger, and I'm going to present on food distribution. There's 3 different projects that I will present on. There's 2 in DRC, and then there's 1 in Syria. And I work on this project in Syria, the first one, and then my colleague Fred and his colleagues in their DRC have sent me presentation materials for their projects. And so I will begin. One of the things that goes on here is we have, it says here both Food for Peace and OFTA funding. OFTA's Office of Foreign Disaster Assistance these are both USAID offices, and they're both being rolled into the Bureau of Humanitarian Assistance. But when both of these projects were started, they were funded separately, and so we have 2 separate projects going on in Syria. Next slide, please. So the point I'll emphasize here is that both projects are in government-controlled areas, and that's Damascus, Homs, various areas around Damascus. And working in government-controlled areas of Syria is a little bit complicated. There is security issues, fuel crises, inflation, moving money into Syria is difficult, and we have to collaborate with a broad array of partners in order to move things into Syria, in order to have our projects function. But this is just a brief overview of the two projects here. You can see that we're working rural Damascus and homes, 8 food distributions to 50,000 people. And we're working with livelihood assistance for 626 households also. The 5 Core project is working in revitalizing the wash sector and rebuilding infrastructure, including housing in a similar area. Next slide. So the topics today were COVID and food distribution and COVID and gender. And so I'll first talk a little bit about COVID and food distribution in Syria. I think one of the things that's been really amazing in Syria is the donor flexibility. You know, we're using combined OCHA funding, that's the Office for Coordination of Humanitarian Affairs. We're using OFTA funding out of the WASH funding. And we're also, it doesn't say it here, but we're using Food for Peace funding also to fund our COVID-19 preventative measures. And the donor environment, they're very collaborative, they're all communicating, and there's no issues with us using funding from whatever source has the money available at the time. And so that's been helpful for us. You know, a lot of what we're doing for COVID during food distributions are the usual steps. And you know, these are things you're probably familiar with from where you live in the world. Social distancing, hand sanitizers, masks for staff and beneficiaries. There's no vaccine yet, so we're just ensuring that those steps are taken with our food distribution. And you can see below, you know, the staff, the ADRA staff person and the vendor in the back left both have masks, but the beneficiary doesn't. And, you know, I think that's a sample of how sometimes our behavior change doesn't always get to the level we would like it to, or maybe there's a poverty issue, or who knows with the mask. But we do work hard to maintain spacing along the way. Another point that we work hard at is ensuring that all parties have a voice in the process. And, you know, that includes the government, that includes SARC, the Syrian Arabian Red Crescent. It includes vendors, it includes ADRA, it includes beneficiaries. And so we work hard to ensure that all voices are heard, that if there's issues, we know about them, that everyone has a voice in how the food is distributed, how the vouchers are distributed, who distributes the food, how we set up the food distribution and the logistics. And we found that to be quite helpful. One of the things we're doing that's maybe not usual in the, you know, social distancing and masks sort of thing is we provided time slots for each beneficiary to arrive so that we would reduce overcrowding at the distribution sites. And we found that has had some excellent impacts for us in reducing the crowding. It has introduced a level of complexity that's a little even more than usual, but we feel it's worth it and it's worked out well. Next slide, please. And then another topic was asked to talk about was COVID and gender-based violence, or COVID and gender. You know, anytime you're distributing food to the needy, this is something everyone's concerned about, whether there's COVID or not. So I would just emphasize that what we're doing is reinforcing the GBV activities during COVID, because most of these steps you see on the page, in fact, all the steps you see on this page and the next slide, we do anyway. We ensure that, you know, there's a community participatory approach. Communities choose distribution points. Communities have a voice in it. We want to make sure that the community is protected, just as USAID does, and just as everyone involved in this food distribution does. So we work hard at that. We work hard at training all staff, all vendors are trained in protection. And this is an ADRA global issue. I mean, ADRA International is working hard on protection issues around the world. And so we work hard to incorporate those. We do and have and will continue to work hard to incorporate those steps into our food distribution programs. All distribution points have both male and female staff, both ADRA and partners. I think that's a key point. We want to have a fair number of people there to make sure nothing happens. Distribution only during daylight hours. We don't want people out on this wandering the streets at nighttime, getting home. Next slide, please. We do post-distribution monitoring too after each distribution to see what issues came up. We found no gender-based issues so far that I'm aware of in our post-distribution monitoring, but you know, that does provide a method of checking on what happened during distribution. We get some We've had some complaints about the types of foods offered, etc. But we feel as though we're doing a good job of protecting the gender, protecting women and children during the distribution process. We collect complaints via multiple methods. I mean, we inform all participants about the various mechanisms. We have face-to-face complaints. It says telephone, but cellular telephone complaints, complaint boxes. I'm trying to think, do we have another one? Those are the three that come to mind at the moment. So we do work hard at ensuring that we hear the complaints of the community and that we know what it is how we can make our services better, not just on gender, but on anything we're doing. On to the next slide, please. So this is Fred's presentation on FADREC, and just a little bit of background here on what FADREC is. FADREC is a food distribution project in the Kasai region of DRC, and it benefits Congolese returnees from Angola and their host families. This is another USAID-funded, formerly Food for Peace project. You can see the areas we'll talk about on Fred's slides, integrating gender, sexual exploitation, distribution during COVID. So, and there's some photos. Fred has some great photos going on. So I kind of like his photos. We'll look forward to getting to those. Next slide, please. So during identification registration, we incorporate gender throughout. And this is, as I mentioned earlier, this pre-exists COVID. We want to make sure the beneficiaries committee, they make sure the identification registration committees are 60% female. Women form a majority of the complaint committees and the management of the help desk. We sensitize communities to allow women to take the role of the household head for distributed commodities. So we do a lot of work on going out there and making sure the community understands that what it is we're doing and the benefits to the women. During distribution, women receive the food commodities. They can be assisted by their spouse. That's not a problem, but we try to make sure that women receive the food. Women can be represented by their husband or their child or a close relative if that person's registered to receive the food. We want, we have the community involved, and we want to make sure that, if a mother is sick or ill or can't make it, we want to make sure she gets the food, but we also want to make sure that that the food arrives to the family that's intended. So we do some we do make sure the family receives the food, and we try to make sure the community knows who these women are, who's coming, and so that's the point there. On to the next slide, please. So for protection from sexual exploitation and abuse, again, we do this all the time. All project staff are trained on this. Before field visits, they receive a brief reminders of standards for gender and PSEA. Staff are encouraged to report any negative matter observed on gender, and we take them seriously. We get issues, we investigate them, we make sure we resolve them, we make sure that the complaints are heard, that the community knows what was done when it does occur. We make sure all the communities and local authorities are trained on the gender needs, both before, during, and after the distributions. This is mission critical for us in the work we do, so we spend a fair amount of time doing that. Key subjects during the beneficiary community training are complaint management, PSEA, and gender roles, etc. Next slide, please. And then distribution guidelines during COVID. You see on the left there, they have actually some chalk drawn out lines for social distancing. But so we've developed operational guidelines that we're ensuring are implemented for each one of these along the way, training on COVID management, including signs and symptoms. Appropriate steps are taken during distribution. As I mentioned earlier with Syria, this can add a little bit to the logistics of it, but again, we need to protect our beneficiaries. And we incorporate COVID into the design of distribution sites, such as hand washing stations, temperature taking area, distance required, etc. When the white lines you've seen on the left, I've already discussed, we try to keep lines short at the distribution points to allow for rapid service to the beneficiaries. And we, as per like Syria, we end distributions by 4:30 in the afternoon so that people can return home in the daylight. Down on number 3 there, we emphasize COVID messages through megaphones, behavior change materials, and through our own example to the people. We We want to protect our staff, but we also want our staff to be an example to the people of proper COVID management. So we work hard at ensuring that our staff understands and provides a good example for the community. On to the next slide, please. There's some good pictures here. You see identification, hand washing points, zone de partage. I don't speak French, so I don't know what that means, but nonetheless, on to the next slide. Good here, you see waiting areas, hand washing stations, social distancing, beneficiary verification, and then the food distribution going on. I think zone de partage is food sharing area, so that's that there. On to the next slide, please. So now we're moving on to FABELU, and FABELU is a food distribution and road rehabilitation project in North Kivu. I actually shortened this presentation a fair amount because I felt like, going through this for the third time, I was repeating a fair amount. There's some good pictures and whatnot in this. And this is a tough part of the world also. There's been civil war in North Kivu for some time. This project was originally an Ebola project, but now that Ebola has been declared free, it is continuing to work. North Kivu is also in the DRC Congo, thank you. It's continuing to work with roads. Well, on to the next slide, we'll get there. It's continuing to work with road rehabilitation and food distribution. Just a picture on the right. I don't know if there's much in this that we haven't talked about but this is a just to emphasize the point that this is a tougher part of the world, if you will. On to the next slide. You see some food distribution here. Not as much social distancing as I would personally like, but they're doing what they can. You notice the masks at the top right there. We make sure the women and pregnant women and children are served quickly, and we make sure that they get assistance carrying the food to their house. Again, it's male and female teams assisting them if they need it. And I felt otherwise that I was just repeating with this third presentation, so I removed some of the similar information. The basic point is we work. We're doing all of the COVID prevention steps along the way that you would anticipate, and we incorporate gender throughout our work, both pre and during, and even into the future post-COVID. We will continue to do all of the work we do to ensure that children, women are protected during our programs. So I think that's it from me. Is that my last slide? Merci, gracias. That's my French there, merci. Thank you all.
Thank you, Chris. Thank you, Josue, Helena, Valeria. Thank you for your presentations. Now we're going to move into the question and answer session of the presentation. And I would just like to, what I'm going to do is I'm going to try and split it into the English speaking questions and also have a separate Spanish speaking questions, where when we ask and answer those questions, you will be able to switch back into the English and Spanish tabs in your Zoom window there. So for starters, we're just going to have the questions in English, and this is actually a question for Helena. For households that had both women and men registered as head of households, how were you able to ensure that they were actually from a single household?
Hi, Victoria. Thank you very much. The team does a regular run-of-the-mill verification process in which we actually choose a random sample size of our beneficiaries to visit their home in person and verify in person just the situation of the household, including heads of household and who's actually there and all of that. So it's an in-person verification based on a random sample size.
Okay, thank you very much for that. Another question is regarding how the e-vouchers are received. So do households need to have a smartphone or something to actually receive e-vouchers? How does that process work?
Great question. They don't need a smartphone or a computer to receive it, because what we provide them is the equivalent or something very similar to a credit card. So the company we work with, which is Sodexo, provides physical plastic cards. They look just like a credit card. And then ADRA handles ensuring that it is recharged on a monthly basis for the duration of the implementation of the project. If they do have a smartphone, they can download the application from the company and check on their balance on a daily basis. And in particular, with this population that we're working with, the Venezuelan population, they do usually have access to smartphones, but they don't absolutely need them to receive their e-voucher.
So if they lost their card, for example, would they still be able to use a smartphone to utilize that card, or does the smartphone just
If they lose their
what's on the card?
Oh, I'm sorry. If they lose their card, they report it to ADRA, and ADRA gets them a new card.
Okay. Okay. Once COVID-19 came, did you notice a change in which family members did the purchasing with the e-voucher, or which family member did the purchasing?
So when COVID-19 came, what we noticed was there was actually fear from everyone in the household to really go anywhere, including purchasing food. So what happened at first is that people didn't want to go out at all, not even to purchase the food that they needed. And we had to do a lot of work of contacting households and encouraging them to still go to the grocery stores, obviously in a safe way, wearing their face coverings, keeping physical distance from the people around and avoiding crowds, but to still purchase their food. When finally confidence came back, there wasn't really any change as to who purchased the food, because it was still the women who prepared the food, and so they're the ones who know what to purchase. So we didn't notice any significant change in that regard.
Okay, oh, very good. Thank you very much for that, Elena.
Thank you.
Valeria, I have some questions for you, and I just want to give you and Deborah a chance to prepare for that, and also to let everybody know that you can use the interpretation function at the bottom of your screen for this question and answer session. So we're going to just allow some time for the question to be translated and also the answer to be translated. And I'm going to select English. So Deborah, that will give you the chance to translate my question as well. So how did you manage distributions during COVID-19? And if there were any specific steps you took to ensure inclusiveness when planning for distributions, could you mention a few of these?
Sorry, can you repeat, please, or Deborah? Because I don't know if the last one or...
Deborah, can you, I'm in the English translation section, so I'm not sure if Deborah's actually going to hear me or not.
It's okay. Can you repeat the question, please? In English, it's okay.
I can hear you, Deborah. Okay. Okay. How did you manage distributions during COVID-19? And were there any specific steps you took to ensure inclusiveness when planning for distributions? If so, could you share a few?
Sorry, I didn't hear. ADRA, Debra, ¿de pronto tú me escuchas? No puedo escuchar. No escucho nada, ni en español, ni, bueno, en inglés solo a ti no te escucho.
Sorry, Victoria, if you repeat the question, I can translate for Valeria.
Okay. How did you manage distributions during COVID-19? And were there any specific steps you took to ensure inclusiveness when planning for distributions? If so, could you mention a few?
Valeria, la pregunta es, ADRA Ecuador, ¿cómo gestionó las distribuciones durante esta época de COVID-19? ¿Y qué medidas tomaron de protección de género en esas distribuciones?
Gracias, Elena, disculpen. Bien, ¿cómo manejamos las distribuciones? Siempre las hacemos, obviamente, de manera presencial, ¿no? Me refiero a las distribuciones.
Valeria.
Sorry.
No, perdón, lo que vamos a hacer es no utilizar el función de traducción simultánea, así que si puedes hacer
Okay,
como
listo.
en partes. Gracias.
Dale. Bien, entonces para las distribuciones que hicimos en el caso de intervenciones de agua, saneamiento y higiene,
For the wash distributions that we did,
hemos, digamos, tenido en este contexto de emergencia sanitaria unos protocolos o desarrollado unos protocolos específicos para la distribución.
we've developed some specific protocols, some specific sanitary and hygiene protocols for these distributions.
Bien, en estos protocolos lo que hacíamos es, si tenemos que realizar distribución de gran cantidad de kits y no podemos ir casa por casa.
So what we did is, if we have to do a large distribution of kits, we can't go house by house.
Entonces sectorizamos a la población y escogemos unos puntos de distribución.
So we sectorized, we divided the population by sector, and we chose a few locations in each sector.
Y a esos puntos de encuentro convocamos a las personas por turnos.
And so what we did is we called people to those locations. Thank you. We called people to those locations during scheduled periods.
Bien, entonces quizás hay algunas personas que están más alejadas y que no están cerca de ninguno de los puntos de encuentro.
In some locations, there were people who were maybe a little bit farther away and they weren't near the distribution sites. Sí, adelante, Valeria. ¿Aló, me escuchas, Valeria?
Entonces, con estas personas... Sí, hola, hola, hola.
Sí, sí, adelante.
¿Me escuchó?
Sí, sí.
Con estas personas realizamos entrega en domicilio.
And so with those people, they did household door-to-door distribution.
Con respecto a cómo transversalizamos el género.
In regards to mainstreaming gender.
Todos los equipos están preparados para lo que hablábamos antes, identificación y referencia de casos de violencia basada en género, perdón.
No, está bien. All of the teams, as we discussed earlier, were trained in terms of how to identify gender-based violence.
Específicamente en este contexto de emergencia sanitaria, el confinamiento elevó mucho los niveles de violencia intrafamiliar y de género. Por eso era importante tener preparados a los equipos para dar respuesta.
Specifically in this sanitary emergency, there have been elevated numbers of domestic violence. And so it's been important for the teams to be alert, to be able to identify those cases in visiting the households.
Y aquí fue muy importante la capacitación porque muchas veces un trabajador humanitario quiere dar una respuesta y no está preparado para eso.
Which is why it was important to give the training ahead of time, because many times a humanitarian worker wants to be able to help respond but doesn't know how.
Entonces pueden generar acciones con daño.
So this can generate actions that create damage.
Entonces esto, y además incluimos algunos mensajes siempre de difusión de rutas de atención para violencia de género.
In addition, we also disseminated information about channels for where people could go in cases of gender-based violence.
Y por otro lado, en los lugares en donde trabajamos con líderes comunitarios,
on the other side, on the other hand, where we worked in places with community leaders,
siempre intentamos tener paridad de género, tener siempre participación de mujeres.
we always tried to have gender parity and we always tried to have participation of women.
Creo que con eso contesté la pregunta.
I hope that with this, I answered the question.
Thanks very much for that, Valerie. It was good because you answered, I think, two of the questions, one specifically about gender-based violence. So thank you for that. Perhaps in the chat or in some of the resources that we send out after this webinar, we could also have a link that other projects could use for a referral. That would be fantastic as well.
A referral in what way, Victoria?
I think for the curriculum or the training that
sí, muchas gracias, Valeria, por esta respuesta y Victoria cree que contestaste también a otra pregunta que alguien tuvo en cuanto a la violencia basada en género. También varios están pidiendo el recurso que ustedes en ADRA Ecuador utilizan, el currículo para capacitar a los equipos de ADRA Ecuador en cuanto a todo lo que mencionaste en tu presentación. Y si estás dispuesta a compartirlo, quizás lo podemos hacer después de la presentación en todos los recursos que vamos a compartir, incluso las presentaciones.
Ok, perfecto.
Another question also for you, Valeria, is data by sex, gender and age. This is in relation to one of your slides which discussed data by sex, gender and age. So the question is, while data on sex is straightforward, how would data on gender be gathered, or could that be gathered, or how was it gathered, or how could it be gathered?
Otra pregunta, Valeria, también para ti. Es una de las preguntas que viste antes. Que tiene que ver con un punto que compartiste en tu diapositiva que dijo que los datos por sexo, género e edad. La pregunta es, mientras que los datos sobre el sexo son sencillos, me pregunto cómo se recopilaron o podrían recopilarse los datos sobre el género. Si tienes alguna respuesta, por favor, en cuanto a eso.
Ok. En realidad, creo que los datos por género son más fáciles de recopilar que los de sexo.
Valeria says that she thinks really that data around gender is easier to collect than data around sex.
Porque lo que nosotros vemos es digamos, nosotros cuando hacemos los registros, en general no preguntamos géneros porque juzgamos a la persona por su apariencia, ¿verdad?
Because what we're asking when we are creating the registries is that when we ask about gender, we're generally judging it based on appearance, no?
Y la apariencia está basada más bien en los imaginarios sociales, en los roles, en la expresión de género.
And appearance is based more in societal norms, in what's agreed upon, which is a description of gender.
Ok, entonces por eso digo que es más fácil recopilar género.
Which is why I say that it's easier to gather gender, because usually gender is based on appearance, and appearance, usually gender is what determines appearance, because our gender, I think you understand what I'm saying. Gender and appearance are linked,
Ok, pero entonces, ¿qué hacemos para recopilar todos los datos? Podemos poner en nuestra planilla sexo, y ahí ponemos hombre, mujer o intersexual, porque acordémonos que hay muchas personas intersexuales también.
But so what do we do in order to collect the information that we need? What we do in our forms is we put, for sex, we put male, female, and transsexual or intersexual, depending on the language you're using, because we can't forget that there is that other option as well.
Ya, ok, entiendo. Y ponemos también género, y ahí ponemos femenino, masculino o transgénero.
And when we're talking about gender, we put for that question masculine, feminine, or transgender.
Muchas veces cuando vos le das esas opciones a las personas, entonces se sienten más libres de poder identificarse, digamos, dar su identidad de género o su sexo, por ejemplo.
Many times when you give those options to people, they feel more free to choose their gender and sexual option more freely.
Ya, ok. Entonces, básicamente podemos hacerlos de esa manera, con los formularios. No vamos a ir más allá, a interrogar más. Si la persona no nos quiere comentar sobre su identidad de género, nosotros miramos que posiblemente es una persona transgénero, pero esta persona no se identifica así, no la inscribimos así.
So we basically just do it through the forms. We don't ask more questions or demand more in-depth information. We let the person identify the person's self through the forms, and don't try and push things otherwise. I think that's...
Thank you very much. Yeah, thanks very much, both of you, for Deborah, especially for your translation, and also Valeria. Chris, I have a couple of questions for the presentation that you did as well. This first question is regarding PSEA complaint. If ADRA ever received a PSEA complaint, how would it be determined if the legal authorities would need to be involved or not?
So thank you for that question. It's a good one. I would say it goes context by context, to be honest, and situation by situation. And the reason I say that is there are parts of the world in which ADRA works where there effectively are no legal authorities, or the legal enforcement is weak. There are parts of the world where ADRA works where I've been in a couple where I feel like the police are just looking for bribes, and you wouldn't want to introduce the police to, I don't know, that's my take. So some of the time the police are not always on or the legal authorities are not always on the side of those that are offended. So we have to maintain sensitivity to that. One of the things we do with our community participative approach is we train the community in what's PSEA a little bit going on there. So we know that so that they are empowered to provide their feedback and then talk about what would happen if this situation occurs. I think it comes down to a leadership conversation on each incident. And then, another point I would make is we report to USAID. USAID wants to know the complaints every month. What complaints do we get? And that's everything from, the food distributed to this sort of thing. And so we maintain a level of openness to changing what we do if a decision was made that could have been made better. Leadership discusses it, USAID, donors, we discuss it. There's there's a committee at food distribution committee, for example, in DRC that works at a UN agency. So there's a fair number of voices going on in this process and context in where we distribute food to make sure that we're not further offending the rights of the people that might have seen a PSEA dispute. But I guess it comes down to, it's a context by context situation. What is the actual situation where the event occurred? I hope that begins to answer the question.
Yeah, and I suppose that would come down to making sure that ADRA takes the responsibility to make sure that it understands what that local context is in each country, because as you say, it's going to be quite varied.
And often it varies even within the country.
Yeah. So just a second question. For the FADREC project, does it ever backfire on the women if they are the ones that we're ensuring that receive the food commodities? So, yeah. For example, do their spouses or other male family members feel animosity against them because their wives or female family members are getting the food and commodities instead of them?
Yeah, so that can occur, and we work hard to emphasize the food is for the entire family. I may have put too much emphasis on women receiving the food, etc. We want to ensure the entire family knows the food is for the entire family. I think a step we take, which has been a good step there, is empowering the community. For learning, for instance, for preventing this, the community has a voice in the process, and we think that's important, that the community has a voice in knowing what's going on and reporting back to us that are issues that are occurring, to make sure that we're always self-improving. We're continually looking, we have various mechanisms of post-distribution, surveys is one, but various mechanisms to make sure we're improving what we're doing, and community input is important for that. One point I forgot to mention for the FADREC is actually it's not just the returnees that get food. If they're living with a host family, that host family also gets food, because it's hard to imagine that we would just give food to the returnees and not the host family who might be assisting them, may be related, may not be related, whatever the situation is. So I think it's kind of a complicated answer, but there are multiple methods we take to ensure that's not happening. It does happen rarely, fortunately, is my experience. I don't know if others have different experiences, but we work hard through a number of mechanisms to make sure that that we minimize it, if you will. I hope that was a good answer.
Yeah, and I also liked the point you raised in your presentation about how women can actually nominate close family members to receive the assistance should they be unable to attend. You can just imagine women being dragged off to come and pick up a quota, even if they're sick or unable to, normally would be unable to attend. So it's good to see that that's sensitive to their needs and not actually creating an additional burden for them.
Yep.
That brings us to the end of our question and answer session, and also the end of our webinar. And I just really want to thank each of our four presenters again. It's been really valuable to hear the different perspectives and the different categories that we've included in today's webinar. I also just want to remind each of the listeners that we will be sharing the slides and we will be sharing the recording of today's webinar, and I really want to encourage you and also to ask you to participate and fill out the post-webinar questionnaire and survey that we'll be sending out shortly after this webinar, because these webinars have a lot of effort and work that goes into preparing them, and we really want to make sure that what we do is effective and worthwhile. And so your feedback is important. We definitely take that on board. And we'd love to hear from you, and keep well, stay safe, keep washing your hands and social distancing, and take care, everybody. Good night, good morning, good day, and farewell.
Thank you.
Thank you.